Why is minimum inhibitory concentration important for child antibiotics? Imagine trying to stop a tiny bacteria from growing in a child's body. To do this effectively, doctors need to know the smallest amount of medicine that can actually prevent those bacteria from multiplying. That's where the concept of minimum inhibitory concentration, or MIC, comes in. MIC is the lowest concentration of an antibiotic that can stop visible bacterial growth in a lab setting. It helps doctors choose the right antibiotic and dose for each child, making sure the medicine works well without causing unnecessary side effects. Knowing the MIC is really important because it shows which antibiotics are likely to be effective against the bacteria causing an infection. If the bacteria are sensitive to an antibiotic, the MIC will be low, meaning only a small amount of medicine is needed. If the bacteria are resistant, the MIC will be high, and that antibiotic might not work at all. But MIC alone isn't enough. Doctors also look at how the drug moves through a child's body, which is called pharmacokinetics, and how the drug affects bacteria over time, called pharmacodynamics. These factors are especially important in children because their bodies process medicines differently than adults. Children's bodies change as they grow, so their ability to absorb, distribute, and eliminate antibiotics varies. For example, a young child's liver and kidneys work differently than an older child's. This means that dosing must be carefully adjusted to make sure the drug reaches the right levels in the blood to kill bacteria without causing harm. Some antibiotics need to stay above the MIC in the blood for a certain amount of time, while others need to reach a high peak level compared to the MIC. By combining MIC data with knowledge of how a child's body handles medication, doctors can create personalized treatment plans. In practice, MIC helps pediatricians pick antibiotics that are most likely to work against the bacteria causing the infection. It guides them in choosing the right dose and frequency to make sure the medicine is effective. It also helps monitor if bacteria are becoming resistant over time, which is a growing concern. If bacteria develop resistance, their MIC values tend to increase, signaling that the bacteria are harder to kill. This information is vital for maintaining the effectiveness of antibiotics and preventing the spread of resistant bacteria. Using MIC wisely supports good antibiotic stewardship, meaning antibiotics are used carefully and responsibly. This helps ensure that children get the best possible treatment for their bacterial infections while reducing the risk of side effects and resistance. Overall, MIC is a key tool that helps doctors provide safe, effective, and targeted antibiotic therapy for children with bacterial illnesses. But always remember, treatment decisions should be made by healthcare professionals who consider all these factors along with the child's unique health needs.